Good afternoon, everybody. Thanks again for joining. Today, we are here. We're so glad you're here. We are here to talk about telemedicine, specifically with bloodborne pathogens, BBP, and excited to share some great content with you. We've got a phenomenal guest speaker with us who's got a lot of great things to share. And just a quick note as far as the agenda itself, we'll be going through introductions. So I want to be able to share with you who all's on the call today and presenting. In addition to that, we'll go through the telemedicine services offering, really diving into and taking a deep dive into the bloodborne pathogen process and really how it relates to telemedicine. And then we'll talk about specifically that patient journey. So how an employee can seek medical treatment if and when they need to, what that, from a technology standpoint, what that looks like. And then we'll definitely have time at the end for Q&A. So just know that there is an opportunity for you to type in questions within the Q&A, and we'll have plenty of time to get to those after the discussion today. So without further ado, I would like to get started. First off, want to maybe pass it over to Dr. Figueroa so that she can introduce herself, and then I will introduce who I am.
Thank you, Deanna. Hello, everyone. Thanks for joining us today. I'm Dr. Lisa Figueroa. I've been with Concentra 14 years, and I am a Vice President of Medical Operations and the National Medical Director for Health Information Technology, and also the National Medical Director for Telemedicine. So all of the clinicians who provide telemedicine care, they all report to me. I'm the supervisory clinician, and I make sure that we deliver the best service that we can for our patients. Deanna?
Thank you, Dr. Figueroa. My name is Deanna Adams. I am the Director of Sales for Concentra's National Telemedicine Program. I have been with the organization now for almost 9 years, and I really support customers who utilize this platform. I help with the onboarding process, patient journey, and ensuring that customers who participate in this program really have a great experience. Glad to be on the call today with all of you. I'm going to kick us off just with an overview of Concentra Telemedicine, and then I'm going to pass it over to Dr. Figueroa to talk about more specifics on the BBP. So many of you may or may not know, Concentra Telemedicine was introduced in 2017. We have had this platform now for a number of years, and I think that is significant because this is not something that is brand new to Concentra. We've had a number of years to really perfect this program. We have seen and treated well over 250, conducted 250,000 virtual visits since inception of the program. You can see here where telemedicine is currently available. Quite a large footprint. We are in a total of 44 states. What is really, really nice about our footprint is that you don't have to necessarily be within close proximity or a certain distance to a Concentra brick and mortar. So the goal and really idea and concept of Concentra Telemedicine is to widen the reach, allow for better access to care in places where you may not have access to occupational health. We've been in this industry now for 40 years. We've got a lot of occupational health expertise, and we're able to share that through this virtual care platform. It is a visual audio experience. It is simply probably what you think it is if you've had any experience with virtual care. We call this program Concentra Telemedicine, and I'm going to pass it over to Dr. Figueroa to really highlight some great things about the program.
Yeah, thank you, Deanna. So as many of you probably know, Concentra is well-known occupational medicine leader in the industry, 40 plus years of experience. That experience includes extensive workers' comp injury experience and care. We are focused on our outcomes. We have an extensive knowledge and understanding of state regulations, OSHA recordability, the importance of returning employees back to work, and that we utilize the same clinical model for our clinicians as we do in center. So that same model in center applies for our telemedicine clinicians. So our experience is we started in 2017, as Deanna mentioned, and launched our program, and we've been doing extremely well. And the clinicians that provide the care to the patients are all Concentra employees. We do not have 1099 clinicians, so they're all trained as if they were working in centers with that same level of knowledge and expertise to provide care to telemedicine patients as if they were in a center. We have a stable video platform that we use for our telemedicine visits that provides us 24/7 support. We also utilize the same EHR and telemedicine that we do in our centers, so that information that's available in centers is available to our telemedicine clinicians and vice versa. And part of the launch process with telemedicine is that if you're a Concentra client, there's no access fees or upcharges to launch telemedicine for your employees. The patient engagement, what's really nice about telemedicine, and Deanna mentioned this already, is the access to the care. So we provide 24 hours a day, 7 days a week. We work on the holidays. We don't even take 5 minutes off. So we are available for employees every day, any time of the day. They can access telemedicine utilizing their smartphone or a computer or a tablet. So easy access there. And the really nice thing about the virtual visit with the clinicians is the clinicians are very focused. They're 100% focused on the patient with that audio-visual experience. It's always audio-visual, and that clinician provides them focused care and care to help them alleviate some of their anxieties and provide them the treatment plans that they are looking for to get back to work as soon as possible. So effective communication, the same communication that we provide in our centers to our employers and patients, are provided via telemedicine through the same mechanism, whether that's the hub or other communication avenues. That information about return to work is available immediately after the patient visits Concentra telemedicine. So there are no gaps in that communication at all. We'll move to the next slide, please, Deanna. So what types of injuries do we see at Concentra telemedicine? These are relatively minor injuries, and we understand that not all injuries are appropriate for telemedicine. So these are the injuries that are minor strains and sprains, bruises, contusions, relatively minor burns, as well as cuts and scrapes. Obviously, we cannot provide care for those wounds that require sutures, but we also provide care for work-related rashes, the tendonitis and repetitive use injuries, carpal tunnel syndrome, for example, and of course, what we're speaking about today, bloodborne pathogen exposures. And next one. So bloodborne pathogens, most of you that are on this call understand what a bloodborne pathogen is, but just as a quick refresher, a bloodborne pathogen is an infectious microorganism found in human blood or body fluids that can cause disease. So some of the most common infectious diseases we're concerned about potentially during an exposure are hepatitis B, hepatitis C, and HIV. So what qualifies as a BBP exposure? It's funny that some people really don't understand that an exposure with intact skin does not qualify as a bloodborne pathogen exposure. It has to be exposure to mucous membranes, that's the eyes, mouth, ears, nose, or non-intact skin. So whether it's a puncture wound or that there's a lesion that's on the patient's, let's say they get blood splashed on their arm, the skin is intact, that's not an exposure. But if there's an open lesion or a cut or a healing wound, then there is a potential for exposure at that point. Any splashes to the mucous membranes, as I mentioned, those are an avenue for exposures as well, are considered for BBP visits. So the next slide, please. So the exposed patient versus the source patient. So who's the exposed patient? The exposed patient is the individual whose skin, eye, or mucous membranes, non-intact skin, or other area is in contact with blood or other potential infectious material. That's what OPIM stands for, from a source patient. And bloodborne pathogens entering the body, I mentioned already, mucous membranes and open wounds. And the source patient is the individual whose blood or has come in contact with other person's skin, eye, mucous membrane, or non-intact skin. So let me just put it this way. I think that sometimes just the verbiage itself can be a little confusing. So the exposed patient, let's say, is a pharmacist who has just given a vaccination to a patient. Once they remove the needle from that patient, they stick themselves. They are considered the exposed patient, and the patient who has just received the vaccine is the source patient. So source patient testing is having that patient, for example, that just received that vaccine, get tested for HIV, hepatitis B, and hepatitis C. And next slide. So is source testing required? Well, it is not required, but it is strongly recommended. Having this information from the source really provides the clinicians and the patients or the exposed patient tremendous relief when that source patient is negative for HIV, hepatitis B, and hepatitis C. So anxiety is reduced. Consider that patient who just had the vaccine has negative testing for all of these diseases, then there's no chance that the exposed patient has to get these infectious diseases from that incident. So I think that's really an important point. So it alleviates anxiety. It helps lower claims costs because that case is over. There is no need to have further testing of that exposed patient. It helps reduce time missed at work and potential harm from HIV medications. So patients that don't have source, the exposed patients that don't have source testing results may be considered high risk, and they would have to start post-exposure prophylactic medications. And those are not only costly, but they have a potential for some really negative side effects to the individuals taking those medications. So can the exposed patient be tested without the source patient and vice versa? We will always see source patients for those patients that are associated with the exposed. So if they're the source for the exposed patient we are seeing, we will absolutely see them. What we don't do at Concentra Telemed is see source patients when we are not seeing the exposed patient for that particular incident. Okay, next slide, please. So what does the patient workflow look like when they join Concentra Telemed for BBP exposure? So the patient comes to see us, and that's either through the employer or nurse triage. They ask the patient or direct the patient to Concentra Telemedicine. The care coordinator meets and greets the patient and gathers all the information necessary. That includes demographic information as well as clinical information, which is their allergies, current medications, medical history. All that information is gathered by the care coordinators and entered into our EHR. Then the patient is placed into the clinician's waiting room, and the clinician picks up that patient, conducts the interview with them, gets all the necessary information, and determines whether or not there's high risk for infectious disease with HIV, and determines whether post-exposure prophylactic medication is needed. They also order baseline lab testing for that exposed patient. When the visit is over, the information is sent, the lab requisition is sent to the patient, and they take that requisition to an outside laboratory. We highly recommend that it's Quest. We will send patients to other laboratories if it's not convenient, but the reason we recommend or suggest Quest is because we have a national relationship with Quest, and we are able to submit those lab orders electronically and also receive the results directly back into the EHR, into that patient's record when the results are in for that patient. So it makes it for a nice seamless order and result reporting. If they are an outside laboratory, we get that information faxed to us and then we just upload it into our EHR. So it's convenient for the patient because they receive their lab requisition, they go to the lab drawing facility, and we have the results available when we see them back within 3 to 5 days of their initial visit. If the test results come back and they're negative for their baseline, if we do not have the source patient's results saying they're all negative, we do provide recurring visits on a medical surveillance standpoint. So we see them 3 months and up to 6 months to ensure that they're not going to contact any of those infectious diseases. Okay, next slide is for the source patient workflow. If the source patient agrees to a Concentra Telemed visit, the care coordinator greets the source patient, gets all their information. The source patient sees the clinician. The clinician orders the baseline labs for them, and just like the exposed patients, they receive a requisition. They go to an outside laboratory and we receive the results back. If anything is positive, if there is concern with any of the results that we receive, the clinician contacts that source patient and tells them to follow up with their primary treating clinician. And that is fairly simple for the source patients, and we want to make it as easy as possible and as efficient as possible for those patients, so that they would agree to have their blood tested. That would significantly reduce the anxiety of the exposed, as well as reduce claims and reduce case duration. And Deanna, it's to you now. Thank you.
Thank you so much. Appreciate you taking a deeper dive into BBP, the workflow specific to exposed and source patient. I'm going to transition and just talk a little bit about really how that exposed employee would get to Concentra Telemedicine, what would be required, and we'll touch on technology as well. One of the things I really want to highlight is there is still an authorization process with Concentra Telemedicine. So I'm sure you're probably used to, if you're working with a Concentra brick and mortar facility, you likely are authorizing visits for any center visits. Telemedicine is no different. We do have an additional way for individuals to authorize. So we sometimes will have folks go through nurse triage, as Dr. Figueroa mentioned. That certainly is an entry point into telemedicine. But if this is what we would consider maybe a direct program, then certainly you would be able to do hub authorization. Hopefully you're familiar with the hub. You could also send an email directly to telemed@concentra.com. There is a dedicated inbox email distribution that is simply for authorizations, and that's another option if you have maybe a supervisor, manager, somebody authorizing a visit that does not have access to the Concentra hub. And then as a last resort, we certainly never want to delay patient care. So if a verbal authorization works better for your organization, that is also an option. Simply having that supervisor or manager come onto the screen at the time that the visit is starting to be able to provide verbal authorization, that certainly is sufficient as well. We have a handful of clients that know that maybe it's a 24/7 operation and it's an after hour situation, and maybe there's just not an opportunity for authorization. There are some protocols we can put in place specific to your organization. We would just want to communicate with you on what that looks like, but we never want to delay patient care, and we know specifically with bloodborne pathogens how time sensitive those exposures can be. So just know that as a part of working with Concentra Telemedicine, the authorization process is something that we come alongside and work with you on to determine really what the best way to get authorization to telemedicine so that we can quickly see and treat your employees. Now, there are multiple access points to Concentra Telemedicine. So we've mentioned nurse triage. I would say that if you've got a nurse triage program, it's a real easy way to be able to get this service activated if you don't have it already. I think that the workflows that we have with nurse triage, and we've got relationships nationally with pretty much every nurse triage partner out there, and work really closely with them to ensure that there's really set, nice, firm workflows to get the patient from nurse triage directly to Concentra Telemedicine without, a lot of hand-holding or involvement from maybe your frontline managers or leaders. The process is truly facilitated by nurse triage, and we'll dig into that here in a second. The other ways are our employer direct models. We do have a customer service number, but mostly I would say folks are more comfortable with a QR code or a web address to be able to simply it's an on-demand platform, so you don't have to go through triage. If you don't have a nurse triage, that's perfectly okay. There's an easy way that you can get to us. Claims reporting software, I wanted to mention this simply because a lot of folks do have, pretty sophisticated claims reporting software like a RIMA system, something of that nature. Those are great programs that are already in place where you can activate, and we've seen some success with employers where they can automate having telemedicine pop up as an option once they input the injury into their RIMA system. So if that's you, if you've got some sort of claims reporting software already in place, we could certainly support you in figuring out the easiest way to get Concentra Telemedicine on as an option, specifically even for those exposures. Now, the next couple of slides, we're just going to talk about the workflow and really what it looks like for an employee, an exposed patient likely, that is going through the process with nurse triage and then without nurse triage. I want to highlight really from the beginning, just because telemedicine, this virtual care option may be a possibility, it certainly does not mean that your internal process should change. So we always really want to emphasize the employee should always still follow the same process that they do today. So if there is an internal reporting system, if there likely is a nurse triage dedicated phone line that you have, that they would contact that nurse first, we want them to go through that process. So telemedicine does not change that initial reporting process or initially contacting triage. Once they get in contact with the nurse and they've engaged with that nurse and they've gone through the details of the exposure, the nurse, I'll be honest, when it comes to bloodborne pathogen, telemedicine is probably the easiest and the best way for an exposed patient to get immediate care. And so likely that nurse would offer a virtual care option, the telemedicine option, to be able to connect with the clinician to start the process. If that employee says, yes, great, let's do it, then what will happen is, in majority of the cases, they actually schedule a time. It can be a stat request, which means that that employee is ready to be seen right now, or it could be a situation where they might need to find privacy in a location where they can conduct a visit. So perhaps maybe 30 minutes or an hour from now. The nurse triage partner will communicate with Concentra Telemedicine the preferred time of the visit for your employee. We will then create a patient account where we will simply send a link via email and text directly to that employee. They can click on the link and that will take them to that landing page of being able to register and get connected with the visit. So really simple when it comes to getting the employee to us, as I mentioned, with nurse triage. Not a lot of involvement on your end with directing or providing instructions. All of that is done once they schedule a visit with nurse triage. That's communicated to us. We automatically send that link to the patient at their scheduled visit time. Now, once they log on and register, which takes about 2 to 3 minutes, it's a very quick process to register. We don't do any of our medical history, medical questionnaires through the online registration. It is all done verbally with the care coordinator. And I think that that really can save a lot of time and really creates ease of use when looking at participating in a telemed visit. So once they connect with the care coordinator, that is when we will do all of their verbal intake. We will get them checked in. We will have already received authorization from the nurse triage company, so we will not be asking the employee for that. And then from there, we will get them connected to that clinician. So they generally go into a virtual waiting room until it's time for that clinician to connect. As soon as that clinician is available, they will connect and be able to have that one-on-one consultation with the employee. We want to make sure that they have privacy during that visit. And they'll be going through, obviously, a series of questions, really examining true exposure versus not a true exposure. As Dr. Figueroa mentioned earlier, there are some differences, and it may be a situation where the doctor is able to identify that it's not a true exposure. The patient, should they need baseline lab testing, as Dr. Figueroa mentioned, that is something that will be scheduled. We will be able to write a lab requisition order. And then once they complete their time with the clinician, then from there, they're able to be connected back to the care coordinator for any follow-up that's needed. We will pre-schedule any visits that need to take place. Sometimes that's done right away. Sometimes that's done on the back end, but we will schedule, there will be a follow-up scheduled with that particular patient so that they can come back and review lab testing. I do, and then from there, obviously the patient will receive a copy of the documentation just like they would in a brick and mortar center. We email that to them, but then also you will receive any kind of work activity status through the hub. So all of that is sent real time once the visit disconnects. One of the things I do want to mention, because there may be some health systems on this call today who maybe have the question, well, what if I have my own lab? Is that a possibility? And I want to ensure you that if you have access to your own lab, We have a lot of clients that are in healthcare themselves, and so they understand healthcare, but they also have maybe an easier way for their exposed employee to be able to get the labs completed and done, maybe an on-site lab. So there are a variety of different ways, and same thing with the source patient testing, right? If you have your own lab or you have access to processing labs, that certainly is a possibility. So just wanted to mention that along the way as we talk about kind of next steps in scheduling those visits for them to go get their baseline labs drawn. There's a lot of flexibility around that area. So that's the process for nurse triage. I'm going to transition to what we call the employer direct. So this would be for an employer that does not have nurse triage in place. Perfectly fine. This process can work just as well. I would say emphasizing the same thing, your internal process does not change when it comes to accessing telemedicine. It's important. I would say it's more important than ever, especially on a direct program, that you have processes in place where they're reporting accordingly, and that really whoever is doing the intake internally on that injured worker or that particular exposure, that they know that telemedicine is an option. Too often I see customers that are really excited about the telemedicine offering, but they just don't know why folks aren't using it. And a lot of times it's simply that they don't have someone who can communicate the virtual care option to the exposed patient. So it's really important on step 2 that, if they do say yes, that they are given that QR code or they're given some instructions. We can support in that area, but I would say that's probably the biggest difference in looking in the nurse triage workflow versus this employer direct workflow, is that you've got to have someone internally who can direct and give that employee the option of doing the telemedicine visit. Otherwise, they may not know that it is an option. Steps 3 through 6 are honestly pretty identical to the workflow that we just saw previously when it comes to the care coordinator, the transition to the clinician for the medical visit, any kind of follow-up that's needed, the checkout process, we call it, and then lastly, the reporting and the documentation. So those last 4 steps really flow just like the nurse triage workflow. It's really those first few steps that are different when it comes to a nurse triage program and a direct program. So let's talk about technology. We really have done, I think, a fabulous job of really trying to make this as easy as possible. We do encourage a quiet private location. I know I mentioned that a minute ago, but that's important because we want to make sure, just because this is a virtual care visit doesn't mean that, we should sacrifice the quality of the visit. We want that employee to have privacy just like they would have in a brick and mortar facility. So the patient, helping that employee find a place where they can go in privacy and talk about that exposure with the clinician, I think is really key. Most everyone these days carries around a smartphone. 85% of people just use a smartphone, but I will say there are other avenues. If you've got maybe a company, a dedicated laptop, a desktop, even an iPad that you want to dedicate to virtual care visits and to Concentra telemedicine, that is certainly an option too. We are very flexible on the device. This is where you as the employer get a lot of choice and decision making on what you want this to look like. The only thing that we ask is that employee have access to a webcam, a microphone, and strong internet connectivity. If they have those 3 things, they will be able to successfully access Concentra telemedicine with no issues. The web address, Concentra Telemed, as I mentioned, is probably the easiest way on a direct program if they're coming onto the platform. The QR code has gotten quite popular. I think since COVID, more and more people are certainly more comfortable with QR codes. So we've got some resources where you can have a QR code available, or a resource that has the QR code. If someone's maybe a little bit more tech savvy and feels like they know what to do when they see that QR code, that's also an option. Now, there is an app that's available for download. It is a free app. There is no cost to download the app. Some people still like to download apps, and that's great. Some people don't know their Apple ID and password, and they're not able to download an app. So we don't want that to be a barrier. So just know the app is a possibility, but not a mandate or a requirement if they would prefer to go that route. The patient, your employee, will be providing an email address. So they're going to create a profile specific to themselves. So this is not one company email that's used for all of your exposures. Every employee, any incident that occurs, any exposure that happens, and they are participating in a telemedicine visit, they will be using their own email address to register. They create a password of their choosing, and then from there, they use those login credentials for that initial visit and any future visits specific to them. That is a non-negotiable as far as the email address. It is a requirement to be able to log in. Now, they will also be sharing photo identification, just like when you go to the doctor yourself, you do have to likely show identification. So we do want to verify they are who they say they are before we get started. So ID is something that if they've got handy and available, we will be asking for that. We do have the technical support line that aligns with our hours of operation, which are 24/7. So if for whatever reason there's technical support that's needed, we certainly have a resource for that as well. So I'm going to wrap up with really what's next, how you can support your employees, and then from there we'll open it up to Q&A if there's any questions in the chat. So with this program, as Dr. Figueroa mentioned earlier, there are no contracts, there are no fees, there's no cost to start up this program. As a Concentra customer, you have access to this, option for access to care. The idea, as we've said all along, this is not to change or take away from your process, but really to enhance your process. I would certainly be looking at and trying to identify, are we using the emergency department after hours for these exposures? Are we in a place where we really want to be able to streamline our program? Are you potentially offering or doing maybe processing your own exposures in-house? We've seen a lot of health systems who've transitioned that program over to us because they've identified that internally they don't want to have access to some of those records. They would like for somebody else to facilitate that process. And so when you're looking at the reasons to possibly initiate this program, just know it's from a cost perspective, I would say huge opportunity with cost savings. But in addition to that, there is some education and training that may need to take place. So although there's no financial investment, I would say there's a bit of a time investment if this is something that you want to participate in. And that is really identifying, who do we want to communicate this to? How do we want to communicate it to? Do we have a dedicated device we want to have folks use? Do we want to offer our own? Are we limited on space? Our email address is going to be an issue. So these are things to really just internally maybe consider. You've got a great team behind you. Our team is dedicated to doing just this, coming alongside you, helping you answer these questions, and then creating a program where you can really roll this out effectively and efficiently with the support of our team who specializes in implementation specific to bloodborne pathogens. So we do have a video available that's a great demo of what a telemedicine visit looks like if you'd like to see that. We also have a starter kit. We've got an FAQ. We've got patient instructions. I can tell you our marketing team does a fabulous job, and there is no shortage of resources when it comes to telemedicine. So the ask for you is really, if this is something that you are interested in learning more about and would like to schedule some time with me individually. Also, Dr. Figueroa is always happy to join. We'd love to meet with you. We'd love to understand your current program, and we'd love to see how we can maybe help streamlining your program when it comes to these exposures by using Concentra telemedicine. So with that, I'm going to transition. I'm not sure if there's any questions in the chat, but if there are, please take some time. If you have any questions, I'll give it a couple minutes and you guys can post those in the chat.
And I just want to add one thing I think that is important that I did not mention is that our experience with bloodborne pathogen exposures. This is not something that we just started recently. We've been doing this for quite some time now. And during the peak of vaccine season, so I'm thinking October, November, Concentra telemedicine can see upwards of 900 visits in a month that are bloodborne pathogen exposures. And because we have been doing this for such a long time and with such frequency, and we follow the same bloodborne pathogen exposure that is written for our center clinicians, and we have the expertise at Concentra, and our telemedicine operations team is phenomenal because they will ensure that the patients get, and I call it a concierge type service for these patients, where they go to get their labs drawn. If they need post-exposure prophylactic medication, they will work with the patient and the pharmacy to ensure that they get it expeditiously because time is of the essence. And if the patient has questions, they are always available to make sure that we handhold the patients through this experience, because we know it's anxiety producing, and we know that the sooner we get them the treatment they need and answer all the questions that they may have, the less anxiety these folks will have and the confidence that they'll have in Concentra Telemed. So we provide a very nice service, and we've done this so many times. So our experience and our people and how much we care about our patients, I think really speaks to why we have so many BBP patients that come to Concentra Telemed. I know I sound like an advertisement, but I think it's important that you all understand that this is not just one other service that we provide at Concentra Telemed. We really treat these patients, well, all patients, but we really do treat these patients very well and make sure they are handheld throughout the entire process. So I know I bled into some Q&A time, but I really felt like I needed to say that to all of you who are listening.
Thank you so much, Dr. Figueroa. I appreciate that.
Mhm.
I just want to take the time to thank you all for joining today. I hope that you learned something new about Concentra telemedicine and specifically the BBP workflow and how we can maybe support your organization if exposures is something that your employees are at risk of. So once again, thank you for joining. Appreciate all of your time today and hope that you guys have a great afternoon.
Thank you all.